Good evening. This is week 2 of Social Work 505. So let's go over the requirements for week 2, which is on skill building, engagement, and contracting with clients, and assessment and goal formation. So starting with the introduction. This week's unit addresses engagement, contracting, and the initial stages of assessment for goal formation. So in keeping with the collaborative model, we're exploring that initial stage of engagement, developing a trusting relationship with our clients through a strengths-based approach. In the initial session with clients, we will be gathering information and beginning the process of building trust. Through data collection and initial assessments, keeping the strengths perspective in mind, we begin to develop collaborative goal plans that utilize strengths to accomplish goals as defined by the clients. These are the assessment essential elements of client-centered practice. So first, this week is a short video that goes over from an introductory point of view, skill building, engagement, and contracting with clients. In terms of the learning objectives for this week, they are to demonstrate an understanding of the skills in engaging clients in a collaborative helping process and in establishing professional helping relationships. Also, to demonstrate understanding of assessment, intervention, and evaluation with individual clients. So let's look at the learning resources for week 2. The learning resources are as follows. There are 2 chapters in the Pullen book, Strengths-Based Generalist Practice, a Collaborative Approach, and the links to those 2 chapters are here. The Collaborative Model Task Inputs and Practice Skills, and Generalist Practice with Individuals. Also, the Chapter 5 from the Schulman text on skills in the work phase. There is also a video for week 2, and it is available through this link, and you are required then to use your library code to log in to view this video. It is called Clinical Interviewing Intake Assessment and Therapeutic Alliance by John Summers Flanagan and Rita Summers Flanagan. So although you're encouraged to watch the entire video, which is a couple of hours, you are asked to mainly focus on minutes 6 to minute 59. And it gives a lot of examples of client interviewing. Next, there are 2 discussion activities for this week. So the first is working with your assigned dyad partner, and all of you have partners except for one person because this is a class of 13. So for those of you who do have dyad partners, find a video of a social worker interviewing a client, preferably an initial interview, and together post a working link of the video to the discussion forum, and based on course materials for this week, write a critique outlining the skills you observed, the strengths of the interview, and areas that you think could be improved. The critique is a joint effort and should be between 400 to 500 words, and make sure that the names of both dyad partners are on the post. Each of you then must respond to one other dyad's video posting. So each of you then are required to do this in terms of the response. Look at the posting of one other dyad. In your response, discuss similarities and or differences between the video and critique you and your dyad partner posted, and the video and critique posted by this other diet. Your initial post is due Thursday of next week, and your follow-up is due between Friday and Sunday midnight of next week. Your next discussion post is to look at the shared case of Anita, and this case will be used in a multitude of classes throughout your experience at Widener University. So here's the link to the case of Anita, and you are to answer in your initial post the following. What does it mean to contract with clients? Include at least one citation to this week's readings. What other information do you need to know about this family? And how do you prioritize the many challenges facing this family? And this discussion post is set up differently. You will not see other students' responses until you have yourself posted to this discussion. Your response is to at least one other classmate who does not have a response. You are looking at what you learned from your classmates' post and what can you add to their learning around contracting with clients, and make sure to incorporate at least one citation to this week's readings. That's important. So let's talk about some of the concepts from the readings. So this will give you some idea of the readings this week, but again, it provides an overview. Not every concept issue discussed in the readings are here in this PowerPoint, but it is an attempt to focus on some of the concepts in the reading. So, skill building, engagement, and contracting with clients. In terms of that pre-engagement preliminary activities, first, we want to get to know our client. So if you have background information on your client and they are from a cultural group different from you, do research to learn as much as possible. So if you have that opportunity, learn as much as you can. Study the value and belief systems before your interview and ask as many clarifying questions as you can prior to that first interview. During this preliminary phase, the worker sensitizes themselves before each session. If there have been previous sessions, you review those previous sessions and develop preliminary strategies. A narrative approach says that you ask your client to tell their story in their fashion. So you are summarizing to ensure that you are hearing the story correctly and clarifying issues before you get to the actual contracting phase. Practice active listening skills, which means being in the moment with your client, concentrating on both verbal and nonverbal statements, because most of our communication is nonverbal. So be practicing active listening skills. Try to concentrate on what's going on with your client versus what you have to do later in the evening or back at the office. And use as many open-ended questions as you can so that your clients can actually tell their story in their own way. We listen for meaning and feeling. We demonstrate empathy, which means we try to put ourselves in the other person's shoes and identify feeling content and provide validation for what the client is saying. Other pre-engagement activities include clarifying how you and the client will work together. How many sessions? What's the expectation about time and meeting appointments or canceling an appointment? All those things we need to clarify before we get very far into the contracting phase. Clarify the client expectations. Maybe this is the first time they're ever coming to use the services of a social worker. Explain the helping process and outline your expectations, again, in terms of the process. Once we get to doing an actual biopsychosocial assessment, we want to do that from a strengths-based assessment, which incorporates the ecosystems and strengths perspective. It's easy to focus on all the problems that a client brings to our attention, but also being able to examine resilience. So again, problems, but also their resilience and how they have met problem situations in the past and been able to deal with them. Focus on the present and the here and now, although some understanding of past experiences is also needed. So if we are into traditional psychotherapy, we might focus much more on the past and how that's impacting the present. Much of our therapeutic approaches focus now more on the current, the here and now, but it doesn't negate, especially trauma-informed practice, seeing what is in the past that may be impacting a client's ability to move forward. Focus is on many domains, so there are more domains that we could focus on, but here I've listed the biologic, the psychological, how people are functioning socially, their environment, where do they live, what neighborhood, what community, what's the resources in that community, their current financial situation, their education, and again, histories. In terms of that middle phase, once you begin with your client and you all have agreed on a course of action, we get into the contracting. And in order to take steps and move forward, complex tasks have to be broken down into their smaller parts so they can be addressed one at a time. Otherwise, it might seem overwhelming that a huge problem, if we try to tackle everything all at once, clients could get overwhelmed. So we break things down into smaller tasks, and we help clients identify options. We avoid giving advice, telling people what to do, but we help them identify options and then they make the decision. In that work phase, we are actually doing goal setting, which is what we aspire to, objectives, which are much more specific and measurable, those smaller tasks and activities that are broken down then to address the target problem, issue or issues. We're including specific intervention strategies at this point. Clients need a lot of support through this process. We establish clear boundaries in sharing feelings in the area of use of self. There are some times when it's appropriate to provide some information and background on yourself, but always remember that it's not about you, it's about your work with the client. So sometimes clients want to distract and ask you lots of personal questions, but if it's not important to the therapeutic relationship, then always remember to turn that back and concentrate on what's important for the client. But sometimes in establishing relationships, sharing some information may be okay. Just be careful in terms of the boundaries. And workers must handle issues of transference and countertransference. Sometimes clients want to transfer feelings that they are experiencing onto the worker, and there may be times that you as a worker, the client is stirring up issues that you have yourself experienced. And in terms of countertransference, working with a supervisor and supervision is very, very important for working through those kinds of issues. Transference issues, it's important to recognize when clients may be transferring onto you some of the things that they've experienced and be ready to handle those situations. There's always a termination disengagement phase to working with our clients. So at that point, we identify what has been achieved We generalize the learning that clients have learned so that they can transfer that into other situations. We review the relationship, including determination and feelings about ending, and identify next steps for the client. And here are some of the references that were utilized in this PowerPoint from the reading. So, if you have any questions this week in terms of the requirements, please let me know. I look forward to reading your post and hope that you have a wonderful week. And since next week is Labor Day and many of you who work will have off, have a great Labor Day weekend. Thank you.